total reserves at this time.
Are there any questions? I'm seeing none. Okay. Well, thank you so much for the update. We appreciate it.
Yes, and I should add too, I'm on a FPHS work group. There's a meeting today at 2, actually. And we're going to be presenting, I was on a work group to present to the full ELK team, the 35 LHJs, on the future allocation of FPHS. So I'll do that, probably lead into Commissioner Waldrop's legislative update. Thank you.
Okay, and with that, let's move into the legislative. I don't think we have a staff person to update us, but I know Commissioner Waldrop, you had some comments.
Yes, I just got back from DC late last night, and I was there for the National Association of Counties, where we talked a lot about, I'm on the Health Policy Committee, so that was more around Medicaid and other healthcare policies. Then I was able to participate in the National Boards of Health Legislative Lobby Days, which is where we joined up with NACHO, the National Association of County Health Officials. And so, and in between, I did a little bit of Spokane County visits as well. But Jamie Bodden, the Washington State Public Health WASALFO director, was with me. And so she gave me some updates on the state of the state budget. So great news is that both the House and the Senate budget rejected the original cuts that were proposed in the governor's budget for public health and restored them completely. And she said that's really huge. So we should be really thankful to see that. So for the remainder of the session, the main issue is that shortfall that was in that fund, the $21 million shortfall that was supposedly allocated last year, but it was in this fund that was redefined, the cigarette vapor fund, and was used for other purposes. So there's still bills alive to fix that fund starting July 1 of this year. But unfortunately, we went a whole first year of the biennium with those funds not being where they were supposed to be. So that's still a TBD. And maybe Kim has more updates from if those 21 million will be restored or not. So we still will need to keep working with our legislators on that to see if there's any way to get a partial of those dollars back to public health that were intended for public health. And then policy-wise, there's still a few bills, she said, that were still alive. But the changes in Medicaid are still going to be a challenge for the state to continue covering as many people with the changes at the federal level starting in 2027. So I know that there's some efforts to try and fill the gaps in coverage, but that's still to be determined. And there was a lot of discussion at the NACO Health Policy Committee about those changes and what we could see happening in terms of people not being able to access coverage. She said that the opioid funding got reduced in both budgets, but I think that is because they're trying to focus on treatment, and I need to follow up with her to find out more what she meant by that. I wasn't sure if those were coming out of settlement funds or if those were coming out of the general fund, but I'm wondering if it's related to Medicaid, and they're trying to prioritize people in treatment and make sure those dollars remain to keep people in treatment, but maybe reducing some of the community-based and prevention work if they have to. So I'll follow up with her to find out if that's more Medicaid related or programmatic funding. But yeah, and at the national level, just our federal legislative agenda was very well received. And a lot of other boards of health said, can we get a copy? We want to do that too. And so thanks to Ray and Anne for getting me a digital version to send out to a bunch of different communities from across the country that are interested in, and they're interested in getting involved in kind of advocating for what their needs are. So I can share more about that later, but I don't know if Ray or Kim had any other state related updates. So the big news is the funding was restored, which is huge in terms of the future budget.
Potentially restored. Still got to get through the rest of
That's
the session.
right. But if it's in both budgets, that's a good sign.
Good sign. That's right. Anything else on the legislative side? Questions, comments from anybody? No? Okay. Health Officer, Dr. Velasquez, turn it over to you.
It's not arrowing, not moving. Seems to be frozen. It doesn't like me, but oh, there you go. I'm gonna use the screen to move it. So you need to use the screen when you go next. Arrow in the screen, okay. I think we saw the technical difficulties. So I have a couple of things I want to give you an update, and it won't be very, very long because I want to leave enough time for the quality of life survey. Hopefully this will work. So the first one is just to call out that March is National Nutrition Month. Thank you. And I had the pleasure of co-authoring a op-ed for the spokesman. Don't know if it will be published, with Mary Wood, who runs our WIC services, talking about nutrition. Because we're trying to highlight not just the communicable disease, which is what a lot of people think about when they think about us, but all of the other areas that we're engaged in, taking the opportunity for celebrations like this one and other activities. So more to come on that. If it gets published, I'll make sure you get a copy. So with that, I'm going to move to a quick update on measles, which is still here, hasn't gone away. Actually, from the previous update to this one, if you just look at the numbers, it's kind of doubled from the last time. It was 400 and something. About a week and a half ago, when I put this together, it was about 910 total for the country. The demographics in terms of distribution by age hasn't really changed very much. The good news is we don't have any mortality in 2026. Let's hope that we keep it that way. As you know, there are a number of states in the Southeast and others that are getting hit pretty hard. So we're keeping our fingers crossed that travel and movement keeps our environment clean and we don't get additional, although we've had some in the state of Washington, some exposures that we have participated with other counties, and we have managed to really control really well in Spokane. So I want to say thank you to the teams upstairs that are constantly engaged with this. And you look at the state of Washington, we have total 23 cases, which doesn't sound like a lot, but it is a lot for this early in the year. And no surprises there. We do know about the high number of cases in Snohomish County. And we were associated with the one in Stevens County. So hopefully we're gonna see these numbers either stay or not increase significantly, because we really don't want to follow the trends that we're seeing in some other parts of the country where cases continue to escalate rather quickly. So it's something that we continue to keep an eye on. And when I give you a quick update on the schools, I'll mention MMR because there was some questions at the last board meeting. So one of the questions I heard at one of the last board meetings, and I just want to give a little bit of a quick update and then make a recommendation about a report that you may want to see at another board meeting, is we do have data on not only MMR, but all of the required vaccines for all of the school districts that in the county. And that it goes all the way down to the building level. So I'm going to show you a few examples. And I will probably recommend that Kayla Myers, who is our coordinator for immunizations, she has all of the data for every school in the region. One of these days, something that you may want to take a look at, and she'll be happy to do that. She's probably looking at me going like, are you volunteering me? Yes, I am. She's extremely knowledgeable. You probably have heard her at KSPS News talking about immunizations. So just as a reminder, these are the required vaccines in the state of Washington, and these are required both of public and private schools. All schools have the same requirements. We do track others that have potential health implications, just to make sure that we know exactly what's happening everywhere, and work very closely with our schools. So when you hear this reported, You're going to hear lots of numbers that say out of compliance, complete, exempt, conditional. So I wanted to put the definitions here of what that is, just so we all know exactly the same thing. So out of compliance, basically, we do not have documentation of the appropriate immunity to disease. There are many reasons for that. Sometimes we see that when people don't have records, when people don't have vaccines, or when people travel. Complete, that means that we have documented for the vaccine preventable diseases for which full immunity is required. Those are the ones that I show you that are required by the state. Exempt, there are some children that have exemptions. There's a variety of reasons for exemptions, and those are tracked. And conditional are those that are making progress but are not there yet, and sometimes a matter of timing, sometimes a matter of either relocation, et cetera, et cetera. So we do track those and try to help them as much as we can. So a lot of people say, so what are the vaccine MMR vaccine rates in Spokane County for school-aged kids? So this is a summary. As you can tell, we're tracking a little bit lower than the state, which we traditionally have tracked a little bit lower than the state. But I'm going to give you a couple of this numbers that go behind this. This represents 80,271 students, which is a population that is being followed. And of those, 74,423 have the recommended immunizations, which means about 5,848 do not. And that's how we end up with that 92.9 at the end over here. Okay. Now, what is not complete, of course, if you add those numbers, it will be up to the 5,400 and et cetera, which are the exceptions, the conditionals, and the out of compliance. So that's a question that we get asked all the time, just so you will know what the numbers are for Spokane County in our schools. It's 80,271 students, which is a lot of students. We have a very large school district. So we do track for both public and private, since they're both required. These are our public schools. The darker orange is under 20. The lighter is between 90 and 94% completed, and the green is above 95%. Just to give you an idea, we have 34 private schools and 167 public schools in the county. And about 78% of the public schools are over 90%. The private schools are a little bit lower. So this is what we track. And actually, we can explode that all the way down to the buildings, which we have the data for. I'm giving you today a very high level. And that's why I say I would recommend that we bring Kayla to give you a very full update. This is what it looks like when you aggregate the county completely. These are all the school districts over here. Percent complete, 24-25, the year, percent exempt, and conditional and out of compliance, which will tie back to some of the numbers that I gave you before. And we can do that, as you can tell, by school district, and then in each one of the school district, go down to every building in that school district and tell you exactly what they look like. So that is information that we have. We use this not only for tracking, but we use this for education and also for sharing. If we happen to see any trends that need to be communicated, the team up here works very closely with our partners in K through 12. So we'll say thank you to them for that. I just picked one that was easy because they don't have a lot of buildings. Just to give you an idea how it will be represented if they had multiple buildings, you will see the multiple buildings there. But this is just Medical Lake, which is doing very well. So I figure, hey, let's highlight someone that's doing really well, encourage everybody else to do exactly the same thing. And I can tell you in terms of school buildings, we basically have roughly 201 school buildings within the school districts that we cover, just to give you some numbers of what those totals are. So that is an aggregate of about 201 buildings currently in existence. I know there are a few that are under construction. Anyway, so about 70% of those are over 90%, which is pretty good. We want to keep it that way and keep moving forward on the above 90 or 95% for the schools. So just a quick summary to basically answer a question that I heard at the last board meeting. And there's a significant amount of detail behind all of this that I think is important for us to share with you. Probably, I don't know, that would be a whole presentation on its own because there's a lot of data. Yes, I saw a hand going up.
Sorry, just the 23 out of 24 or 24 out of 25. Is that like older students that have more immunizations?
Which
You
number are
said
you
the
looking at?
percentage out of compliance. You have 23 out of 24 or 24 out of 25. What does that mean?
I think those are the school years, 23 to
Oh,
24.
I thought it meant
No,
like
no, no.
23 out of 24 vaccines.
Let me explain
Oh,
that.
okay. That gives me more
Good point. Yeah.
information.
So
I put a dash.
school
instead or
year
something.
23, 24,
Okay.
and then school year 24, 25, and then we'll have school year 25, 26.
Okay.
What year are we in? 26. Yeah, sorry. Yes. There are a number of categories that people can request an exemption from, including religious exemptions and others. So it seems that we have a high aggregate of segments of the community that applied and received those exemptions. And it could be a long list of things. Many of them are religious exemptions. That I don't know. That would be actually Kayla will probably have that information because we do work with them too. But that I don't know for a fact. So I can check for you. Okay, good point. Yeah. Yes, sir.
Looking at the two pie graphs that have the percentages of the above 90%, between 90 and 90, that right there, between public and private school. I mean, haven't been a lot of cases here locally, so I mean, if I could extrapolate it out kind of nationwide, are similar breakdowns what we see across the country?
It
between
varies
public and
by
private?
it varies by region, but it's not uncommon to have this kind of distribution.
Okay.
Okay.
When you see outbreaks, are the individuals that get one of the measles, mumps, or rubella, do they tend to be in public or private school? Is there a correlation between those amounts, and you see sort of a higher rate of outbreaks in either public or private?
So at least not in the state of Washington. We'll probably have to look at other states with higher prevalence. What we've seen the most is travel-related exposures.
Mhm.
So you don't tie it back to a specific school district. You tie it back to a specific exposure.
Okay.
Particularly when you move west to towards the state of Washington, a lot of ours have been exposures in other parts of the country, so it's not traced back to a school district.
Okay, so just because the private schools have a higher rate of unvaccinated, doesn't necessarily mean you'll see more outbreaks in the private schools.
We won't see a direct correlation, although it's suggestive of lower immunization or immunity. And in that case, if there were an exposure by travel, you will have to be a little bit more assertive with that population. So, but we work very well with our private schools too. I want to say that. It's just that different environments compared to the public schools. Yeah. Good question. So what I'll do is I'll take a look at 3 states that have the highest and see if there's any school data that illustrates any correlation. Okay, so with that, I'm going to move on to, I'm sure you saw the news, the spokesman today about EMS responses and fact that we're kind of plateauing a little bit. So I want to show you a couple of things. I'm going to read a few numbers that I have updated here just to give you some additional perspective. So when we look at EMS response to suspected opioid overdose from September to December, we saw a decrease compared to the previous 12-month average. When we look at January, we saw a slight increase of 3%, but it's still below the average. So we do hope that those trends kind of plateau and then decrease. We've seen also some decreases in some area. I can tell you that from September 2025 to January 26th, EMS responses to suspected opioid overdoses average about 157 per month, which is roughly a 38% decrease compared to January to August of 2025, which was 225 per month. So we're cautiously optimistic that the trend that we have seen in other parts of the country of plateauing and then decreasing may be replicating here. Yes. Mhm. Right. These are recorded responses by EMS. That is correct. And I'm going to tell you a little bit about Narcan because I want to touch on that. That's a good point. So a couple of other things I want to say is in January 2026, 31% of suspected opioid overdoses had Narcan administered prior to EMS arrival, which basically tells me that all of the distribution that we all have been doing, not only us, but many of our partners, seems to be having an impact on not only the immediate attention to the person having the overdose, but hopefully is also the reason for that trend in lower mortality. A little bit early to tell, but I think if these numbers continue and we continue having the correlation with increased Narcan distribution and decreased death and mortality and other things, I think we'll have a good story to tell going forward. So I encourage everybody to keep doing that. Now, I want to read a couple of other things for you. I'm going to talk about emergency room visits because we do track those. And as you know, we track a lot of data, but these two are very critical for you to see. So in the fourth quarter of 2025, am I blinding somebody? I hope not. The average number of opioid overdose ED visits was 93 per month, which is a decrease compared to the previous time. In January of 26, there were about 186 overdose visits to the ED, which is an increase, but still below the 12-month average. So you're going to see that fluctuation because these numbers tend to fluctuate month by month.
Are we still online?
We are not. We're online as far as broadcasting
Okay.
the meeting,
So we're
but we
still
are not, like Liz was disconnected.
Okay,
She's back.
there we
And
go. Okay.
So
Sorry,
a couple of other numbers that are, I think
Wait,
these are,
could you repeat
Yes.
that last number again? You said, because I'm looking at the first quarter of 25 and it was 137 visits, right? To the ED.
137 average. Yeah.
And then you said, what was it in January of this
Oh,
year?
yeah. In January 2026 was 186.
Okay, so it did go up.
It did go up about 18% compared to December, but it's still, if you aggregate the whole year, it's still below the average for the year.
Okay.
Once we do all of the months. Good question. So from September the 25th to January the 26th, I did say that the average number of ED visits was about 93 per month if you average all of it out, which is a 30% decrease compared to January to August of the same year. So again, these numbers are starting to tell a better story. Caveat number one is the number of opioid ED visits has increased about 30% among American Indian or Alaska Native communities over the last year, something that we need to be mindful of. And when we look at Spokane County, the rates of ED visits from opioid overdose were higher among adults 18 to 44 of the same American Indian or Alaska Native communities and males. So we got to work on that scenario that we're going to focus a little bit more attention with our partners. I know that all of our partners are very diligently working on that, but it seems that we need a little bit more penetration in that market segment, which is good. But I wanted to share that with you because we always share, we like to share not only when we need to do a little bit better, but also when we're doing something a little bit better, because that's a balance. So I encourage all of us to continue doing what we're doing and just do more of it, because I have a feeling that, and I don't want to predict because I never predict or speculate, but our data scientists, who are the experts, will probably tell us in a few months from now that hopefully we're doing a heck of a lot better. So with that, I'm going to stop here and see if there are any questions for me.
Dr. V, I'm curious, do we have, either have or have the ability to collect data on what percentage of these could be folks who have had repeated overdoses? So unique versus repeat?
There is some of that data that we can collect, and certainly we can show that next time. There's a lot of data behind this data. This is the high level, but then that breaks down into a lot of categories. So we do track all of that, and I see Brittany agreeing, which is good.
And then do we know on deaths where the numbers are trending right now?
I think the numbers have plateaued a little bit. Do you recall? I think that these have plateaued a little bit, but I will double check that for you. And because when we were looking at the last quarter of last year and the first month or so of this year, we saw a little bit of a plateau, and we were correlating that with the increased distribution of Narcan, decreasing the mortality. But I'll double check those for you.
Commissioner?
Yeah, we received at the Board of County Commissioners, we received a presentation on Tuesday from Dr. Singh, the medical examiner, and overdose deaths have kind of plateaued.
Plateaued, yeah.
Yeah, I mean essentially the graph line. I mean it's going up, and then it plateaus. So I mean it's great that it's plateauing or maybe slightly, but it's still at a very, very high level. And if any of you want to see that, if you go to the Spokane County YouTube page, and it was our morning meeting this last Tuesday, and I think she was right at the beginning of the meeting. So you won't have to fast forward in too far into the meeting to see the presentation, but it was very, very in-depth, great coverage.
Awesome.
Yeah, so
Good.
yep, about 20 minutes into the video this last Tuesday of our commission meeting, if you want to see the report.
Great. Thank you very
And
much.
I'm sure she also showed some of the combination of substances and so on. Which is good.
Correct, yeah, the three highest are cocaine, methamphetamine, and then
And
fentanyl.
fentanyl.
Maureen?
I guess my question is that that you said it was trending down as far as visits to the emergency room and calls to the EMS, but opioid use, you can't really say opioid use is going down necessarily,
Correct.
can you? Because people are just using the Narcan, using Narcan better is what you're saying.
That is correct. We're seeing a better outcome, meaning people, by the time the event arrives, they've already been reversed, or they've been reversed and don't require an emergency room visit. But that doesn't mean that the overall usage has gone down dramatically. It only means that we're managing the outcomes better at this point in time.
Yeah.
Yes, sir.
And just one last, just to clarify, to Commissioner Waldrop's question, did you say for this year, 2026, in January, did you say the number was 181? Is that what you said?
Let me
So-
double check. I have it right here.
So the average went down in 2025, but the first month of this year, it's above that average?
2026 January is 153, which is 3% increase from 2025, but still below the overall average.
Okay, but if February and March are on par with January, then, I mean, we certainly will see a quarter increase.
We'll see a little
correct?
bit of a spike.
Okay.
Well, not a spike, but a slight trend upward, as
Okay.
opposed to the plateau that we want to see and then decrease.
Okay,
So let's hope that that's not the case, but we can never predict those.
Tricia?
Yes.
thank you.
The graph is about, or the data is about the Spokane School District. So it's just the Spokane School District, and not the private schools. But Orchard Prairie is the second smallest school district in Spokane. And so the number that 38.9% represents is between 25 and 31 students in all of the Spokane School District. So I just thought that was interesting, and it's just one school. So a lot of the other areas have many more than one school represented, but Orchard Prairie, that has this high number of exempt students, it's just one school, and they have 65 to 80 students at that school.
Yeah, and kind of skews the data because of that. It's smaller size of a population typically skew the data. Good point.
Okay, anything else? If not, we are
So
running out of time for our presentation here. I know it's going to take a little bit of time, so.
So I'm going to introduce Dr. Bannon, Brittany, who's going to do the quality of life survey. And I want to say thank you to Amy and Jackie in communications and Brittany, who worked really, really hard to print all of those for you. And from out here, somebody got a paper cut because they told me about it. Thank you.
Brittany, we've got a couple, maybe 22-ish minutes to try to stay on time, so.
All right, that's perfect. Okay, let me click in here. All right, thank you all. So my name's Brittany Bannon. I'm a research scientist in the data center here at SRHD and the project lead for the Quality of Life project. And so I'm looking forward to sharing with you all today the results of last year's survey. Oh, this is probably better. So I'll start off by just giving a quick project overview of our methods, and then the results that I'll be focusing on sharing with you all today are focused on our two main outcomes of quality of life and social capital among adult residents of Spokane County, as well as other community prioritized issues, including housing, public safety, and mental health. Okay, sorry. So just to start us off here, so the Quality of Life project has been around for quite some time. So SRHD conducted the first survey in 2015. This stemmed from an effort of SRHD and our partners to be able to measure and assess the quality of life and well-being of our residents, as well as the factors contributing to quality of life here, and identifying disparities in factors contributing to quality of life, as well as what are the community priorities that will help us guide community improvement efforts and public health improvement efforts in our region. And importantly, I also want to add a note that when this survey began, another big goal was to be able to look at outcomes beyond the county level, but to dive deeper and be able to evaluate health and well-being at sub-county levels. So that includes neighborhoods, cities, commissioner districts, et cetera. First, I just want to take a moment to thank our 2025 project sponsors. So without these sponsors, we really could not have conducted this project. It's a really big effort. And I mentioned that one of the goals of the Quality of Life survey is to look at community needs, strengths, and the disparities. And so this is just a list of some of the ways that the data are typically used and have been used. So for example, we share these results with our internal programs to guide program planning and decision-making. It's a really useful way for us as a government agency to demonstrate accountability to the public that we serve. The data can be useful for informing performance measures for local organizations and partners. For example, we work with place-based initiatives like the Zone to share data that's unique to their strategies and priorities. And the data can also help to develop requests for funding for grant applications so that resources can be allocated to guide community improvement efforts, where they're needed. The survey is typically conducted every other year. That's dependent on our capacity and continued community interest, of course. There have been 6 surveys conducted to date. So I mentioned this began in 2015. The most recent survey was in 2025. The data collection occurred between March and July of last year. The survey includes some core questions that are kept the same with each assessment. So as I mentioned, the primary outcomes, we ask questions about quality of life and social capital. We also ask about physical and mental health and access to health care. Questions about satisfaction with public services and infrastructure. Public safety, which includes experiences with and perceptions of crime and attitudes surrounding local law enforcement. We ask about work, finances, and housing, and discrimination. And in addition to these core questions, each year we do include a rotating module on a topic that's of emergent interest to our community and community partners. So in the past, these topics have included things like paid sick leave, access to childcare. In 2025, the module included questions about digital device and social media use. as far as our recruitment approach, so we provide the survey. The survey is available both in online and paper format. We select a random sample of up to 15,000 household addresses to send invitation letters to for the survey. What this randomization does is it prevents us from having any systematic bias in who we're inviting and providing the opportunity to take the survey. And you know, to the best of our ability, this is kind of the gold standard for ensuring that every household has an equal chance of participating, and that this does include apartment buildings and other types of housing. However, what this does not guarantee is that everyone has an equal probability of responding to the survey. So we know from our own experience and from Pat and research that, for example, adults who are older or retired tend to respond at higher rates than younger adults who are working, who have children in the household, et cetera. And so we use a few different strategies to try to address this non-response bias. One of these strategies that we've used for some time is an oversample. So in that initial list of 15,000 household addresses that we pull, we ensure that a certain proportion of those include an adult who is under the age of 40, as well as those who are from racially or ethnically minoritized groups, because those participants tend to respond at lower rates. We also supplement our random mailing sample with a targeted geographic convenience sample. So I mentioned that one of the priorities is looking at sub-county results. And so we worked with the zone and some local, some of the Spokane Public Library branches, specifically the Downtown Central Library, Hilliard, Shadle, and Liberty Park libraries to distribute the survey. And this ensures that this was an effort to really boost the numbers in areas of the county where we tend to get lower responses, and we have to kind of combine and group things in ways to get a reliable estimate. So that's why we did that approach. And we, and similar to previous years, we also professionally translated the survey into a few different languages. Won't spend too much time on the response rates, but I wanted to show them here just to give you a sense of how successful we were at reaching our target sample. Overall, we received 2,863 responses to the survey. And this is a sufficient sample for us to be able to look at sub-county data. And importantly, we applied a statistical weighting technique to the data. So what this does is that it ensures the results that I'm sharing with you today. So I'll be presenting weighted results for the survey. And so what this does is it ensures that the results are representative not just of the 3,000 people that took the survey, but they're representative of the 426,000 adults who reside in Spokane County, according to the U.S. Census. And these proportions are age, sex, race, ethnicity, marital status, and education. Okay. These slides are not showing very well. So this is just to give you an idea of who initially took the survey. So this is prior to any statistical weighting. And the table, the report that's printed out in front of you, table 1 has all these data and actually far more detail than I'm able to include here. So just to highlight, most adults who responded to the survey were ages 65 and older. The majority were identified as white. Most had a college degree or more years of education. And about half reported having children in the household, ages 0 to 17. Another highlight is that most were married, and about 20% reported having a disability. And so, just so you can see the proportions, after we apply that weighting technique, the appendix table actually shows you, once we apply the weighting, what were the final proportions in the data according to age and gender and those demographic characteristics that I mentioned we weighted on. All right, so into the first of our findings. So for our main outcome of quality of life, we ask residents to rate the quality of life in Spokane. And similar to previous years, most adults, nearly 80%, rated the quality of life here as very good or excellent. Yeah.
On your quality or your survey method, on it says response rates, it says 18% for the random mailing sample. What is 18% of?
So that is out of the 15,000 household addresses that we mailed the survey to.
Okay.
Yeah.
And you said you invited 15. I guess my numbers are not working for me, so I was just trying to figure that out. And what do you consider like a valid sample if you said like there's a population of 426, 413, but
Yeah.
you got 26, 28 valid surveys back, and that's less than 1% of the population.
Oh,
Does that
sorry.
make
Yes.
sense?
Yes. So the response rates are calculated out of the sampling frame that we were trying to reach. So we sent invitations to 15,000. We received 2,800 back, or the random mailings, it was actually more like 2,600 because the responses were combined between the random and the convenient sampling. And so maybe that's why the math isn't mathing for that response rate. So it's actually more like 2,600 for the random mailings, and then a couple hundred we got from the library and the working with the zone. And then the weighted data, what that is each response is a record. And what the final weight does is it tells us how much that response counts for. So underrepresented groups in the responses that we get weighted higher, whereas overrepresented groups get weighted lower, just to balance it and make it representative of who actually lives here. That's a good question. Okay. Oops, I'm sorry. Again, related to quality of life. So most adults, around 80%, rated the quality of life as very good or excellent. However, when we look at across the different survey years, so starting in 2015 through the most recent year, you begin to see a pattern such that after the 2020 survey, a greater proportion of adults rated the quality of life as poor or fair. And similarly, a smaller proportion of adults rated the quality of life as excellent or very good. Another main outcome that we look at in this survey is social capital. So it's a concept that we define it's defined as the degree of social connectedness, the number and the quality of social relationships within a community, within a population that are conducive for health and well-being. So people who have more help, more information from their networks, and who feel a sense of belonging or connectedness to a larger group have higher social capital. And in our survey, we look at 15 different survey questions. We use responses to 15 different survey questions that capture different aspects of social capital. And these include, so you enter these into a formula that then calculates a single social capital score ranging from 0, reflecting the lowest amount of social capital, to 1, reflecting the highest amount of social capital. And just to give you a sense of what some of these questions are, so we have psychological aspects of social capital that are things like feeling safe, general trust in others, personal relational aspects, so things like social support, a sense of belonging to your neighborhood, and civic engagement aspects, so that includes volunteerism, attending religious or faith-based services, things following local government, things along those lines. And so these are the 15 questions that make up, oh, sorry, go ahead. Yeah.
Oh, sorry. Social capital levels were not significantly associated with respondents' sex, race, ethnicity, LGBTQIA plus identity, or caregiver status. And I was just wondering how, as a statistician, how is that so? So those groups would definitely have, differences probably with psychological or social relational or these kinds of things. And so I'm wondering how you came to that conclusion.
Yeah, oh, that's a great question. So we use a statistical technique that kind of compares categories. And really, one thing I should mention is that statistically significant differences are not necessarily the same as meaningful differences. And so you could have a meaningful result that isn't statistically significant. So I would still say maybe there are gender differences, maybe there are differences based on other things. But what the statistical component of that is just saying that these differences are above and beyond what you would expect due to chance alone. And so that's where you get the asterisk that says it's statistically significant, it's statistically meaningful. And so sometimes it's just an issue of maybe, I mean, we don't report, unreliable estimates. We have to have like sufficient numbers, but sometimes the groupings are a little smaller. So we have, depending on, the number of people who are represented by those who report a disability, for example, like it affects your power to detect differences sometimes in the data. So yeah, does that help address
Somewhat.
it somewhat?
Yeah.
Okay.
Yeah.
Yeah.
Brittany, one more follow-up from me.
Yeah.
Just the usage and the definition of the social capital, is that broadly accepted? Is it unique to us? Did we add or subtract anything from how others would do that?
So it comes from, it's a concept that's been around for a while, in sociology is where it stemmed from in research. And so when we initially started the project, a lot of work went into developing the construct and doing like factor analysis, making sure so mapping it onto what research says should be part of this concept and making sure that that's how it works in the data itself. And so we do some of that work. Yeah. Thank you. And so these were the 15 items that made up that social capital score. So I show this because I think it's important to highlight which aspects or areas of social capital Spokane County adults rated highest, whereas where there might be room for improvement and intervention. So for example, adults rated the quality of their family relationships, as well as their neighborhood satisfaction, feeling safe using local parks and green spaces. Those were the highest ranked aspects of social capital. Conversely, there was room for improvement in general social trust, as well as providing unpaid help, volunteering, attending religious faith-based services, and fewer people also reported receiving support from their family or their relatives. This isn't necessarily financial support, just support in general.
Can I ask
Yeah.
to a couple of the ones at the bottom there, the one you just referenced, the receive social support from family or relatives. I mean, could someone put low rating because they don't feel they need any support from their family or relatives? They think, I got my stuff together,
Yeah.
life's good, I don't need support. So they may say, no, I don't receive any support. I mean, is that something that, could skew that to be, wow, there's all these people that aren't receiving support, but maybe they feel they don't need any additional support?
Yeah, no, that is possible. We do, I believe, include a not applicable option in the
okay.
survey. So some of the questions, especially for things like stress too, not everyone experiences a stressor like having to move or losing a job, right? And so we have that not applicable, like did not experience this issue option in the survey itself.
Okay.
So that doesn't get counted into these percentages.
Okay.
Yeah, that's a good question. And I think initially some people might have read that as financial support. And so we actually changed the item a couple of years back to just specify all the different kinds of support because I think people misconstrued it as financial.
Okay.
Yeah. So wording is very important. We also looked at social capital scores broken out by demographic groups. And so those with lower social capital scores tended to be younger adults under the age of 40 as compared to older adults. Those with lower educational attainment, those who reported being single, never married or divorced or separated, those who could not work or were out of work as compared to those who were employed, retired, or stay-at-home caretakers, those from a lower income household, and those who reported having a disability. Oops, I'm sorry. And then as I mentioned, one of the goals of this survey is to look at sub-county levels. So this is a dashboard looking at social capital scores by neighborhood. So social capital scores were averaged among the respondents that lived in a particular neighborhood or group of neighborhoods. And shown here, so the darkest color is the top 25%. So we split the scores into quartiles, and the neighborhoods that scored in the top 25% of social capital were in those dark blue colors, and the lighter blue reflects neighborhoods in the bottom 25%. So this is all relative to the distribution. But you can see here from the chart on the left, so for example, Comstock neighborhood had the highest social capital score. Conversely, Whitman, Nevada Heights, Hilliard, and Bemis reported the lowest social capital. And we could look at these things in relation to other outcomes at the neighborhood level. So we looked at life expectancy by neighborhood, for example, which we know it still has a drastic 17-year difference between certain neighborhoods. And so we were able to show that social capital was strongly related to neighborhood differences in social capital were also linked to neighborhood differences in life expectancy, for example. And so there's other survey findings like mental health and housing stability and
Brittany, generally speaking, if you're looking at these, what's the statistical difference between where, say, Whitman, Nevada is and Comstock? They don't
Yeah.
look that far disparate. And so what's that
Yeah.
statistical difference?
So we can look overall at like if there's an association between neighborhood and social capital, which there was a statistically significant association, but it doesn't tell us where the differences are. And so looking at this, you would assume that it's really the extremes, but you're right. Whitman, I believe it was like a 0.47 out of one, it's a 0 to 1 score. Whereas the highest scoring neighborhoods were still like a 0.7, right? It's not at the top of that scale. So the range is a little restricted.
And what would be good?
Yeah.
Like what is good or great, or like what would you
Yeah.
prefer to see, I suppose?
One is like the highest score possible. The highest score we saw in the data set itself among just individual people was like 0.92. So yeah, there is variability at the individual level, but once you average by neighborhood, it gets a little
Gotcha.
restricted. Yeah. Thank you. Okay, and then I'll shift gears a little bit to some topics that were raised by community in the survey. And so one of the first questions we ask on the survey is an open-ended, what is the most important issue facing the Spokane area today? These data, it's an open-ended narrative text field, and so two of my colleagues analyze these data and theme them out just to identify, what are the common issues that people are noting. Overwhelmingly, homelessness and housing were reported as the top concerns of participants, as well as public safety. That was more specifically, property and drug crime and open drug use, and mental health and addiction. So those three things kind of emerged as the top issues of concern. Most residents, this is over 80% of respondents reported having a current stable, secure housing situation. Yes, Anne.
I noticed that there's a problem with the slides. I can actually project from my computer
Oh,
your
you can?
slides.
Oh, that would
So
be
if you want
great.
to hold on a moment, I'll do that. and then
Okay, yes,
everybody
thank
can see.
you. Do I have to do anything on this end? Okay. Yeah, I was like, oh no. Okay. Thank you. Oh, sorry. I'll wait till further instruction. Yeah.
Can I ask a question while we're
Yeah,
waiting for that?
absolutely.
Did you notice a difference, or can you explain if with the social capital scores, a difference between rural and urban communities?
That's interesting. We have not looked at that. that's something we could, that's definitely something we could look at though.
Yeah, I think that would be really interesting. And even when I'm thinking about some of these things, I'm thinking about the density of the population in particular areas
Yeah, the
compared to others.
opportunity to connect and yeah, absolutely. Okay.
Can I ask, did you say the question, how was the question worded about what do you feel is the most pressing issue, or what, how did you say that was
Oh
worded?
yeah, I actually have it. Let me go back a slide. Oh, Ann, do you
Oh,
mind?
oh,
going-
I'm sorry. Oh, what is the most important
is-
issue facing the Spokane area? Okay, so it's,
That's
so
the
it was a
wording,
question
yes.
of what's facing the area, not necessarily what's facing you
Yes.
personally. Okay, okay. Because that's surprising that housing and homelessness would be that high, but over 80% of the individuals say they're in a very or fairly stable housing situation.
Yeah.
Okay, so it was a region, what is your, for Spokane, not
Yes.
necessarily for your household or situation. Okay.
Yeah.
Okay.
And it was really housing was high, but homelessness was the number one within that kind of category, the top concern. Yeah. Thank you. Do you have it going, Ann? Okay. I'll go like this. Okay. All right. So most adults reported, 81% of adults in Spokane County reported that their current housing situation was very or somewhat stable and secure. I almost said insecure. Oh, sorry. And then most adults were homeowners. So nearly 2/3 reported owning their homes, whereas 20% were renters. When we asked about the quality of people's current housing, nearly 2/3 reported excellent or very good housing quality. 80% reported good or better quality. However, the results for affordability were a little more mixed. So less than half, 40% of adults reported that their current housing was, their affordability was very good or excellent. And actually 34%, about 1 in 3 adults reported poor or fair affordability of their housing. Oh. And then when looking a little bit closer, so I looked across survey years as well. So this is just focused on poor ratings. So in 2019, 8% of adults rated their current housing situation affordability as poor. In this recent 2025 survey, 14 of adults rated their affordability as poor. And I did look at this, I think it was based on a previous year's suggestion. I looked at this by how long people have lived in Spokane County. We asked a question about that. And it seems to be those who have lived here longer overall are less likely to report poor affordability. However, so in that 6 to 10 year range, so people who have been here 6 to 10 years are really hurting right now. That's their proportion is really high. But when I looked across years for each group, it's to the extent that it reflects age. So those who've lived here 20 years or longer, their increase in poor affordability ratings is really steep. So overall, the ratings aren't bad, but since 2019, they've been kind of like going like this. And so one thing from the qualitative data that kind of supports this is that people were really struggling with property taxes, particularly those who were retired and on fixed incomes, reported being taxed into poverty and just really struggling to keep up. And so that was something, to the extent that being here 20 years or longer relates to age, we can look at this by employment and age and other things. So just something for us to look at further, but that was a suggestion from a previous year that was very useful. As far as public safety and crime go, we asked respondents to reflect on the severity of various crime problems in their neighborhood or their community. 22% of adults reported that drug crime was the most serious crime in their area, as well as social disorder, which included things like loitering, graffiti, and that was followed by property crime. But one thing I should mention, so these are, of course, perceptions of crime. These don't necessarily align with actual crime rates. And for several of these crimes, you can see that nearly half of respondents selected the don't know, not sure option, meaning they just didn't know how much of a problem this was in their area. And I think, at least in part, this probably reflects just the more visible nature of certain crimes over others, right? So property crime like arson or open drug use or social disorder, those are very visible things, whereas something like a discriminatory act or even child abuse or neglect might not be, it might be a little more covert. And so that's an important caveat for these results because, again, these are people's perceptions and it's important, but some of these crimes are really tricky to ask about. As far as mental health goes, so we look at frequent mental distress among adults in Spokane County, and this is defined as them reporting 14 or more days of the past 30 days, having stress, depression, other problems with emotions, or just poor mental health. And so in the 2015 Quality of Life Survey, 12% of adults reported frequent mental distress, whereas in the most recent 2025 survey, this proportion doubled to 24% of adults reporting frequent mental distress. We followed up with some questions about treatment and treatment access. So this is just among those who had more recent mental health struggles, so just among the group that reported frequent mental distress, although the numbers do somewhat align for these barriers for all respondents who took the survey. So we ask if they haven't received treatment or counseling in the last year, why not? And these barriers, it's a list of reasons. People could select any that applied, and they could also write in their own if it wasn't a comprehensive enough list. So the top barriers to accessing mental health treatment for adults were affordability. So 28% reported not being able to afford it, not knowing where to go, some other unlisted reason. So looking at the open-ended responses for this primarily included lack of available providers who are either in network or accepting new patients, not being able to get into treatment, so years-long wait lists, lack of follow-up or care coordination from clinics, and also just not being able to fit it into busy life schedules. So having to work around work and family life was really difficult for accessing treatment. Being underinsured, so having insurance that covered treatment but not covering enough was another barrier. And importantly, nearly 16% of adults reported not accessing treatment because they were concerned that their counselor wouldn't keep their information confidential. So this was interesting because it highlights a few things in my mind. I think it could reflect some distrust as well as some stigma around just mental health and mental health care in general. And we do have other items that touch on that, like concern about the negative opinion of family, friends, and community, concerns about negative impacts on employment and other things. So something important to note. Yeah.
So going to that next one, health insurance does not cover any or not enough. Is that, I just don't know much about the health insurance market around physical versus mental health coverage.
Yeah.
I know our MCOs and Medicaid are required to cover both physical and mental health, but is that more on the private pay or the buying like high deductible plans that may not cover mental health care? I was just wondering if anyone in the room had any information on that, or Dr. V or Dr. Lykowski may, I don't know.
Yeah.
I thought we had gotten further around, requiring health insurance to cover mental and physical health and substance treatment, but it sounds like there's still gaps. So,
Yeah, I guess my comment would be there's gaps. You can mandate that an insurance covers physical and mental health, but there's limits. So who's in network is a big limit for insurers. You will cover it. We'll cover this many visits only, but we will cover it with this group of providers, and look at all the counselors we have in our network. But when you actually go, or when you ask patients to, connect with, these are in your network, connect with them and make that they're actually not available. There are long wait times, and many of those people that are in networks aren't actually taking on new patients. So it's just having the insurance companies cover some part of it, doesn't mean there's access. If that makes sense.
I think there's a psychiatrist shortage also.
Right. I just think there's a shortage in mental health professionals. And that came up at the NACO's, National Association of Counties Health Policy Day. And I think there's a resolution, and something that NACO is working on is, loan repayments and encouraging more people to go into that field so that we have more professionals available to people. But thank you.
And those are some things that are and have been on our state agendas and things like that too. I'll just point out we've gone way over because I think it's really important and interesting data, but probably three more minutes and we really have to move on to keep on track. So.
There's only a couple more slides, so. But I just want to point out too that we asked a similar question for barriers to accessing medical and dental care, and kind of in line with your discussion around psychiatrists and specialists. So one of the main barriers for physical healthcare access is lack of specialists, or perceived lack of specialists, like including psychiatrists. So thank you. Okay, next slide, please. Oh, okay, perfect. So to sum up the findings, so overall quality of life and well-being and mental health of Spokane County adults is good or better. So most of the ratings were very positive, in line with previous years. However, you start to see, when I looked across all 6 quality of life assessments spanning a decade, you start to see some patterns, specifically with slightly worsening ratings for quality of life, as well as increases in mental distress reported among adults. As far as social capital goes, there were some disparities in line with where people lived within the county, so neighborhood differences, as well as dependent on people's economic resources, so people who were out of work or unable to work from households with lower income, and not married individuals had lower social capital, or reported lower social capital. And lastly, the top concerns for respondents and adults in Spokane County were housing, particularly availability and affordability of housing, public safety, in particular the drug and property crime, and mental health, including substance use and addiction. These were top priorities for community improvement. Thank you. And I've linked the website it's our data hub for where we post the dashboard, and this executive summary that we have printed out for you can also be accessed digitally there as well. And feel free to reach out if you have any follow-up questions.
Thank you so very much. I think that was really interesting information, and I'm sure I'm going to have several follow-ups for you. So
Sounds good.
Yeah.
Hope so. Thanks.
all right. Okay, with that, we are going to go into our executive session, and so I will turn it over to Michelle to declare the length and reasons for entering executive session.
Thank you. The board will be in executive session to discuss litigation, potential litigation or enforcement actions pursuant to RCW 4230-110-1I, labor negotiation guidance pursuant to RCW 4330-140 sub 4, and review of qualifications of applicants for public employment pursuant to 4230-110-1G. I'm going to think maybe we announce for 30 minutes, or do you think we need 45, Ray?
Why don't we try for 30?
Try for
and we'll
30,
extend.
yeah.
Because I do know that we've got at least one hard stop at 3 o'clock, so we really
Okay,
have to.
perfect. So 30 minutes then. We have all the board members, legal counsel, Rayburn, and Dr. Velasquez to stay at least initially. Thanks.
Okay. Well, with that, we are entering executive session, and we'll return at potentially at 2:32, and we'll announce any extensions as needed. Okay, welcome back, everybody. We did extend our executive session for about 15 minutes, and we are now back live in our regular session. With that, we do have a pair of action items, and I will look for a motion regarding action item 8A.
Mr. Chair, I move that we direct the Spokane Regional Health District Legal Counsel regarding Spokane Regional Health District Administrative Officer position to enter into contract negotiations with candidate A.
Is there a second?
Second.
Okay, motion and a second. Is there anyone wanting to speak to the motion? Okay, seeing none. All in favor of adopting the motion as stated by Commissioner Brooks, please say aye.
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 Any opposed? Okay, or abstaining, and that motion carries. We'll move on to 8B. Is there a motion related to 8B on our agenda?
Mr. Chair, I move to approve Resolution 26-03 with the following adjustments to it this will be regarding approval to provide non-represented employees benefits covering 2026 cost of living COLA and benefits premium cost share. Under effective March 1st, 2026, the compensation is a one-year agreement that will be 3% cost of living adjustment effective March 1st, 2026. And everything, and then striking the other years.
Okay. Everybody understand the motion? Is there a second to that motion?
Second.
Motion and a second. Is there anyone wanting to speak to that motion? Seeing none. Okay. All in favor of approving the motion as stated by Commissioner Brooks, please say aye.
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 Any opposed? Aye. Abstaining? That motion carries. Okay. Well, very good. We got through most of our agenda, or actually all of our agenda, with some time to spare. Is there anything around the room for the good of the order? Anybody would like to share? Just any, Commissioner?
Well, earlier I just mentioned I was in DC, got to meet with folks from different boards of health from around the country, as well as the National Association of Counties. And just, again, our federal agenda very much aligns with the National Associations of County Health Officials agenda in several ways. Got to visit with Representative Baumgartner's staff and Senator Murray herself and her staff, along with other public health leaders from Washington State, and thanked them for making sure in the FY26 budget, we pretty much had stable federal funding, which is what we were asking for in our legislative agenda here from federal sources that come down to the local health districts. So that's the good news, is an FY26 federal budget. We pretty much remained stable with all the funding sources, including the SAMHSA and behavioral health dollars that we had called out in our federal legislative agenda here at SRHD. So that's the good news. And then a couple quick things that is on the radar is there was a public health workforce loan repayment plan that is expiring this year. And so the NACHO is asking that Congress reauthorize that $100 million that could help recruit as many 2,000 public health professionals, because it helps them if they stay at least 3 years in a public health field, that they can get some of their loans repaid. So that needs to be reauthorized by the end of the year. So that was just a heads up. That's something we might want to look at for next year's federal agenda. And then the Public Health Infrastructure and Capacity Program, which was discussed in our Finance Committee meeting. I guess it's known as, what's the acronym for it? Public Health, FIG.
Public Health Infrastructure Grant.
Yes. So FIG, with a PH, is also will need to be refunded. Now, it was like an innovative new source of funding to help health districts retain good workforce, as well as invest in data interoperability and other updates to systems. And so we also talked about that NACCHO's looking for like $1 billion for CDC FIG, because those dollars will run out this year. So interesting things that are going on, and it was good meetings, and hopefully we can see continued stable funding from the federal government.
Great. Anything else for the good of the order from anybody? Seeing none, hearing none, and we do not have anyone who's signed up late to comment, correct? Okay, well, with that, we are at the end of our meeting, so we will call this meeting adjourned and see everybody back for potentially a special in between, but the next scheduled is March 26th. So thanks, everybody.